Hi everyone, my name is Shireen Bryan. I am the Senior Transformation Specialist for System C in the perinatal department. So I am involved in the implementation of BadgerNet at your trust. So today we'll be looking at self-referral and Badger Notes and how to give women access to Badger Notes as well. So I'm just going to turn off my camera because that does help with things, and then I'm going to start off with self-referral before we look at BadgerNet. So this is when the woman obviously found out that she's pregnant and she's going to refer to your services as well. So share my screen. Yeah, this one. Okay, so the BadgerNet self-referral then is a web site, basically. It's not the actual system, it's the website where basically when you set up, you'll be given your unique URL for your trust. Potentially, and then the women would obviously be signposted to this URL, and they'll come onto here, and this is the first page that they're presented with. So it would say something like self-referral your pregnancy to Luton, Bedford, or whatever your care location, or however you're going to implement self-referral, which I'll explain that later. On the first page then, on the landing page, you'll have a little bit of a description about what this is and who you are, and you can configure this yourself. So you can, there's few bits in here that you can actually personalize in here as well. So you can do that, and I'll show you that once we have done the woman's sort of view of it. Once that's done, then they'll be able to click on to start referral. There is a page all about like your data, how your data is going to be used, is it going to be safe, all that kind of stuff. They can click onto those bits and read those, and then they'll agree. Once they agree, then they will have to fill out the self-referral form. The self-referral form has two steps, really. The first step is the personal details, and the third step is the medical questions, which we'll talk about in a bit. So I am not going to go through all this. I'm just going to put in whatever I had before. So in here, then you just complete it. I'm just going to put anything. So just ignore what I'm doing right now. This makes things a bit easier. One, and then I will LMP date. So if they're sure, they can put the date in. If they're not, there is an option to put a roundabout date or how many weeks they think they are. So I'll put that in. And backdate that to 24. Just going to go for that for now. Yep, and then they'll be able to put everything else in. There is a bit for NHS number. This is not mandatory, but it's there for if they do know it. And then they'll have your GP practice codes, GP practice addresses. So again, in your configuration, you'll be able to set what GPs cover your area, and they will be in this list to choose from. You always have a known practice or not registered, and I'll show you how you set that up. And then you're able to put in your address. And by the way, it's completely silent here. If you have any questions while I'm doing this, please ask. Don't wait to the end. Just unmute yourself and ask your question. So once that form is completed and it's done right, hopefully I've done it right. Yes, I have. The next step then is your medical questionnaire. Now, the medical questionnaire can be as long as you like. We have probably about 30 questions that you can choose from. So there is in the settings, you'll be able to see which ones you want to turn on and hide and things like that. So for this care location, these are the questions that you have. So they can go in and answer those questions. Go down. Now, these last ones here are all about the app. So obviously women will no longer have paper notes. They will receive their care on an app. So they'll see all of their notes on our app, not the actual BadgerNet system, but it will be a customer-facing app that they can use. And these three questions are all about if they're happy to agree to have one created, and are they happy to have push notifications sent to their phone, and that kind of thing. So that's what those things ask. We also have an option. For example, I know remind me, Gail, because I can't remember. Is it 3K locations you are for?
2 care locations.
2. Okay, so you could potentially have one spa referral for your 2 care locations, and the woman chooses which one they want to book onto. So you'd have your 2 options there as well. That's also there if you want to, but it's totally up to you how you want to arrange this and how you want to do it. So once they've completed the medical questions, then they'll click on to next, and then they'll just say, basically, if you are doing it on somebody else's behalf, so maybe your GP will be doing this referral rather than the woman, then they can put that in. If they do it themselves, then that's fine. Once they've done that, they press submit. They can say they're normal. There you go. And then it will give you a completed screen. They actually get this screen on an email, so they'll get all this detail in the emails. Again, a lot of this is configurable, so you can see here bits that you can configure around here as well. I think these 3 paragraphs you can configure for your trust, so you can make that up for whatever you need for that. Then that will then get sent to wherever you want it to be sent to, and we'll talk about that in a minute. So that's the end of the in terms of the woman's view of self-referral. Before I go into setup and how you would manage it in your trust, is there any questions about the woman's view? That's fine. So I'm just going to
All good from
unshare.
me.
That's right. I'm just going to unshare that, and then I'm going to move my screen. So I've got like 15 screens going on here, so let's find my right one. 2 seconds. Oh yeah. Okay. So share the screen here. So I'm going to go into setup first to show you what your options are in terms of how you would manage the referral. So once you have your spa referral, self-referral set up, you will have a care location on BadgerNet. This is BadgerNet basically. And you'll have a care location set up in BadgerNet. In your spa setting, this is where you can manage how the referral gets sent and things, and lots of different things. You can do your configuration, you can turn on and off some of those questions that you saw in the medical history. It's all in the setup here. So I'm going to click on to update, and this is the bit that you've got. So you can sort of say in here, in terms of sending the referral and where this referral goes and how you're going to manage it, you can have a centralized, some trusts have a centralized referral place, so maybe it's the community midwives, a community midwives kind of admin place. So you can set that up. So what will happen is you'll just put in your generic email address in here for that centralized place, and then that community hub or community self-referral hub will receive those referrals. It will come as a PDF, so it'll be a PDF document with all of the things that the woman has completed. So you can select that way. As part of that also, you can also send that PDF, send that referral to all the GP that's been nominated. So again, if you choose to do that, so when the woman presses submit, your centralized self-referral hub receives the referral, and also the GP also receives the referral. You can set that up here as well. Also, you did talk about that you do have 2 care locations. Is it Luton and Bedford? I don't want to get wrong the names. Is it Luton and Bedford, Gail?
Yep, Luton
Yep.
and Bedford.
Yeah. So your other option is that rather than a central hub that would house Luton and Bedford, the other option is that you could have one set up for per care location. So one that goes to the ones that if a woman chooses to go to Bedford, then Bedford will get their emails. Bedford hub will get their emails, and if they want to go to Luton, then vice versa. So that's another option you can do. Also, there are bits where you can it can automatically not so much send for you. So based on the GP practice code, for example, so the woman who lives in a certain GP practice code, and you know that all these GP practice codes or GP practices are covered by this particular team. You could also set up that way. You could, as I said, set up by preferred location, so Bedford and Luton, or just straight to a team. So if you had the teams as options, or sites as options, you can also send it via Teams. So there's lots of, in the spa, there's lots of ways you can do it. So you can, I'm not sure how you do self-referrals now. You can almost mimic what you do now if you do it as an automated system. But we've got every single scenario in here, so basically that everybody can use it. So it's really up to you which way you go about doing that. I'm just going to come off of this just to show you about the GP practice code. So if you do choose to send the referral to the GP as well, this is where you'd set up your GPs. So in here you'd find the GP that you want to set up, and then you'll put the email address of that GP. And so when the woman chooses that GP, submits the referral, they will also get the referral PDF. When we talked about the locations then, so you'll have Bedford here, you would have Luton here, then you can say if she selects Bedford, it will go to this email address. If they select Luton, it will go to that email address. That's that. The other option is referral teams. So I'm actually going to go on to one that's been completed.
Shireen, can I just
Yes.
ask you a question? So in the
Yep.
maternity location emails, can you set more than one recipient?
Yes, you can. Yep.
Perfect. Thank you.
Your other option is your teams. So for example, you have the cinnamon team and you know that I didn't particularly click GP, but if I did, if you have GP in here, you know that this particular GP or a number of GPs would sit under the cinnamon midwives. Then again, it would go to this particular team. So there's lots of ways to do it if you set up teams as well. So you have to have a think about how you currently do it, what you'd like to do, and going forward with that. So once the referral is received, however you do it, via email or via our self-referral list, which I'll show you in a minute, that is the main place to do it. You can also, if you needed to, send the email on to somebody else. If you want to, if there's some sort of, I don't know, process you want to send it on to somebody else, you can do that via that too. It all depends on how you want to set up your referrals. I'm going to go back to the update bit to show you some of the configuration I talked about. So in the woman's view, we did talk about some of the things that you can configure. So in terms of the referral and how the referral method is, you can set that up yourself. There is a document on this that tells you where these things go, but basically it just gives you the ability to make it very much personalized to your care location, to your trust. So your help page and your, who to contact and all that kind of stuff will all be there. So you can configure that yourself. And then these are the medical questions that we have currently, which you can hide or show. There's quite a lot there you can choose from. And you can, again, if you do have a referral form, you can should be able to more or less copy your referral form just about. So you can turn on and turn off whichever you like. Is there any questions about the configuration before we look at another option about how you would manage the referrals? Nope, that's fine. As I said, there's a document, and it does take a little bit of discussion around what you currently do and what your plan is to do. So you could completely bypass BadgerNet, and you could just have that the referral is completed on the website, the referral is set up to go to Bedford and set up to go to, for example, Luton, and they receive the referral PDF as an attachment in their email, and from there you could do your normal process and do what you normally do to get that woman booked up for an antenatal booking appointment. So you could do that. Some trusts don't use BadgerNet; they can completely just do that, get the referral in via email, and then they would continue their normal processes. That's fine. You can do that. The other option is to use our self-referral list. So when that woman clicks submit, yes, you'll get an email, but also they'll sit on this list. So you'll have a list, it's called self-referrals, spa referrals, and you'll have a list. I mean, the one you would want to go from is the open referral. So all referrals that are currently open, and you can manage this list. On that list, you'll have the name, you'll have some of the details from the actual referral here that you can choose from and go forward. When you select onto that particular referral, then it brings up their referral record, not their actual pregnancy record. This is just the referral record. On the referral record, a couple of things to show you is what's quite nice. It does work out for you based off of guidance what the ideal time to book date is, what the ideal time for scan and screening would be as well, based off of the LMP date. Okay, so that also comes there. the PDF I was speaking about, so let's go over here quickly, actually. So this is the PDF that here. So when I said that the attachment will come in the email, ignore that. That would be wouldn't be a rabbit. That would be your logo. So this is the PDF that would sit in the email address if it's set up. So this will be an attachment on the email address. This is what it would look like. So it would have everything that's the woman's completed in the email address there, and you can get it from the actual record as well if you're going to use it. Anyway, back to this. So in here then, this is your administration part of the record. So in here, if you're going to manage it from this list, your sort of community hub or your admin could, from the referral, select what team they go to. So they could use this and say, okay, yep, she's on GP. I can select this this community midwife team. This is the way they're going to go to, and you could potentially set up that it goes to that team centralized email address if that's the point as well. You can also, the admin will also be able to just check that they've checked that the national ID, the national NHS number is correct. We're obviously looking at your PAS system, check that they reviewed the referral details, check that they've approved the referral for processing. And then what would happen normally is that on your PAS system, depending on how you're going to do it, obviously the referral needs to be put on PAS, because at the moment only BadgerNet knows that she's pregnant. Your PAS system, I'm not sure what PAS system you use, but your PAS system doesn't know as such. So your admin team would potentially have PAS open at the same time. They would create the referral or whatever you would do normally on PAS to create that maternity record. I'm not sure, Gail, you probably have to talk about this because I'm not sure what you do for your PAS. So yeah, that would be set up.
Well, I've seen that Giselle, community matron from Luton, is on the call, so she probably knows maybe a little bit more about what happens in Luton. Our PAS is IPM.
Yeah.
So I'm sure there is probably a referral that's added to IPM.
IPM, yeah.
In order to create our pregnancy record currently in CMIS. I've got someone nodding there.
That's it.
Thank you.
So that still will have to happen. So that will still happen alongside this referral. So as much as we have set up the self-referral, then they would have to go onto IPM, do what they normally do, because the reason for that also is that part of your interface is when they put that referral onto IPM, that will create the pregnancy record in BadgerNet. There will be an interface message that will send to BadgerNet, and it will create the record in BadgerNet a pregnancy record in the BadgerNet system. Okay, so that will still happen. I'm not sure what happens in Luton, but if that's similar, depending on what system you use, that will also happen. So in a sense, for most trusts, your admin team or whoever is managing this would have BadgerNet self-referral open, but also their IPM, whatever the PAS system is open, and they would do that after. So that's something to think about as well. Once the referral has been closed, and obviously it then comes off of the list. So when you're on the SPA referral and it's been closed, it will come off that list. So this becomes like a working list. So it gives you an option, really. It gives you an option to either just continue by having the email address and you can just manage it from your emails with the PDFs coming through, or you could use this working list, whatever you prefer. As I said, each trust does their own thing, so it depends on what you want to do. Once that's done, then obviously, once the referral has been put on IPM, then BadgerNet will create the actual pregnancy referral in the actual BadgerNet system, which we'll talk about in a minute. Is there any questions around the referral process?
Can I just interject? So in previous trusts, what we've done at this point is we've set up the BadgerNet access for the patient. So it sends the patient an email to say,
I was going to tell you
that. But it's just to let the staff know that this is the point. So rather than having another process added on to the midwives, this will be an admin function. And then when the patient gets to the midwife, firstly, they've been able to fill out some pre-booking questions, which is always nice. But also if they haven't been able to get access, then the midwife can help just troubleshoot that a little bit. Sorry, Shireen, if I've jumped the gun a little.
Yeah, you have, but it's okay.
Sorry.
That's fine. Okay, we'll move on to that then. I don't think there's any more questions with SPA referral. So essentially then, as Gail has said, the IPM is completed. It's been referred to your trust, then what that will do is it will create an account on BadgerNet. So in BadgerNet, the admin team, it sounds like we're going to have, will be able to search now for that woman in BadgerNet. So I'll be able to, I think I've set one up called Bedford. So let's have a look. So search by HS number or whatever. Yep, I've called her Gail Bedford. And they will just search the record. Once they search for the record and find the record, they click onto the record. The record's completely blank because obviously we have not done anything. She's not been booked. Nothing's been happened with her. So this is, again, continues with the admin process. A lot of trusts will continue with this, as Gail has said. And part of that will be then to search for something called portal access. And this is all about giving the woman access to her app before the booking appointment. So this is this. So the portal access note is used for this. They will complete this. Most trusts would have that conversation on the phone or face-to-face or however you're going to do it. They would complete this part. So obviously some of this is already being done as part of the self-referral. So we kind of know the email address. We know the we will know the telephone number as well, but the activation phrase might not be known. So the activation phrase would be something that the woman would have to give you. I'm not sure, Gail, did you do it like that or did you give them a generic one? Because some trusts do a generic one, which I'm not keen on, but some people ask women.
So we started off with generic, but we soon run into problems. So if a lady miscarried and then came back a month later with a new pregnancy, if you wanted to give her the same account activation phrase, it would still link to the old account and not the new pregnancy. So
Right, okay.
we soon kind of decided that we would do individual, and it'd be something like the patient's initials and then the year or the month and year, just something that's quite simple, because I know that we were using baby, BABY, which is simple enough for people to use, but obviously it's not very secure. So exactly. Again, if you know that this patient has reported that they have learning disability or dyslexia, then you might just want to consider the phrase that you're providing, and asking the patient's a really good idea.
Yeah. So some trusts will actually ask the patient. Some trusts will, as I said, when they send the SPA referral, when they get that feedback, it will say on there, please log on to BadgerNet, give it, in the 2 weeks time or something like that. Please log on to BadgerNet and use your activation phrase is your last name and your date of birth. It depends on what you want to do, or you'd phone a woman and get your unique activation phrase. Either whatever way you choose, you need activation phrase to set up BadgerNet notes. Okay, so once you've done all that, then you've put all the details in, you press save and close, and then what will happen is that the account will create on BadgerNet. So I'm going to come off of this and show you what happens in the background. So I'm going to dismiss that. So I'll log out of there actually. And then come over to BadgerNet. So this is the web version of BadgerNet. So this is where, when the portal access note has been created, they also get an email address. They'll get an email to say, we've created a BadgerNet app for you, or account for you. Please log in. Please go on to Apple, Android, or go on the website and register yourself. So they'll come on to wherever they choose to, the app or the website to register. They'll click on register. Again, you have your privacy notice. They will agree that. Then they will put in the email address. I'm just going to quickly what I used find out what I just done. So then they'll use the email address that they was used for their account. So I'm going to use this one. And also the activation phrase that it was set up as well. So put that in. And I think actually, it is correct. Okay, it's not working, then no idea. So let's go back to do this one for now. So when they do that, why is it playing up? Okay. I don't know what's happening with it in the test, but anyway, they put the email address in, they put their security phrase in, and then they would then be asked for a verification code. The verification code will come to their mobile. So on the mobile, they'll get a text, just like internet banking, verification code, put it in. Then they'll set up a password that's unique for them, and then it would open up their Badger Notes. Now, it won't do it for me for here, but what I'll have to do is just go back to my old one that's already set up. That's the verification code that you would put in, which would come from the app. Once it's set up, you won't see this initially. I don't know what's going on with it at the moment, but what would happen initially would be quite blank. And what it would ask you for is basically is to complete what you call a booking. It's a pre-booking, and basically it's a list of notes. I'm not sure if I've got one that I could show you. I don't know why that's not setting up for me. No idea. To when you're doing it on. Let me just quickly. But basically, if I can't show you, I can send you a screenshot, and I'm sure Gay will show you anyway. It will be a pre-booking, so it will just be again a form, a bit like self-referral, but it will be a lot of the questions that have been asked at booking. So it's a bit like giving the woman the handheld notes before the booking. Basically, she would complete all those before the appointment, and then when she comes, the midwife will be able to download them. But we'll look at that next week when we have our next appointment. We'll look at the whole booking process at about that. But yeah, ideally, the whole beauty of having self-referral and the app is that women can book themselves, get all that information done, so that way. Another part of the booking then also is that when they actually on here, they will still see leaflets. So on your leaflets section, we have about 7 or 8, I think, national leaflets that will show up for you, but also you can upload your own leaflets. So you could upload all the leaflets that you would normally give a woman. I'm not sure why everything is going so slow. So apologies here. It must be too early for the computer. But all your recommended leaflets would be here. So any leaflets that you've uploaded for your care location, for your trust set by yourselves would display here. So a lot of trusts, do their localized leaflets would sit here. And again, I'm not sure why it's not showing at this moment time. We are in test, so sometimes that does mess things up. I'm just going to restart this. We just stop sharing and then bear with me. Is there any questions around the setup of the app in terms of getting the actual access to the app? Well, I'll just quickly figure out what's going on here. I wonder if actually it's down in test because it's not appearing on. Okay, I don't know. I can't get onto the leaflets, but essentially, just again, I will show you again next week once it's working. Your leaflets will be in here as well. Once the woman's had the booking, what will happen is they'll have a care plan. So every week they'll have a bubble all the way to 40 weeks, and each bubble they can do certain things. If I just go through the first bubble. Oh my God, what's going on? Right, yeah. We go through the first bubble. So if I go through, like, example, this bubble here, this has got the most on it. So if I click onto 41, it's not going to do anything, is it? There's something wrong with it. I don't know what's going on. Oh, it's terrible. I'm just checking if there's any issues with it in test. Yeah, you haven't opened up. Have you sorted out BadgerNet yet? Have you? Have you been on BadgerNet yet?
No, not yet.
just playing up. I think what I'm going to have to do is probably add this to next week, because I'm not sure what's going on with BadgerNet's test at the moment. I will check with the engineers if it's down or something. I'm not sure. This is not live. This is test. I don't think they're doing anything in the background. It is playing up. But so I think what I'll have to do is continue with. It's going to do it now. Oh, it's working now. It's working now. Okay, right. So each bubble will have 4 tabs. The first tab then will have an overview. So the first thing it will tell you is what is expected on that week. This is coming from NHS Choices. So it's a direct copy of NHS Choices. You can create your own if you like, but it's a direct copy of NHS Choices they can read. So for each week, they'll have sort of a week in a nutshell. They'll have that, and you can configure that yourself as well. They can also, for each week, if they want to, they can upload a picture or a memory. So they can potentially upload a picture of their bump each week for themselves, and they can have it there if they like. Any appointments that's been put onto BadgerNet will show here as well. So I'll have to see any up and coming appointments will be there for them to see. Your next tab is your planned events. So if on that particular week you've got, I don't know, an anticipated booking or anticipated follow-up visit due, then it just gives you a description of what would normally happen in that appointment, as in a generic follow-up appointment, or if you're going to have a blood pressure done or whatever, it will give you sort of like a description of what would happen in that actual appointment. Then, and this is where I think the issues around the leaflets, something not right there. Then recommended for you is where your leaflets, it will tell you what your recommended leaflets is. So part of, which we'll look at when we look at the booking, is that you can set recommended leaflets for each week. So for example, around about the 20 whatever week, you could say, I want to recommend the fetal movement leaflet. That would show up here. So that's say we recommend you read this leaflet. So you can say roughly week by week what leaflets you recommend for the woman to read, and they would appear here. In the leaflets though, she'll have access to all of the leaflets, so she can go to all of the leaflets by this bit up here, the leaflets. That's kind of your leaflet library, but in here we'll just give you the recommended for that particular week. Okay, which is not working right now. And then your next tab then is your plans and diaries. So at the bottom here, you've got a diary page here, so they can write a diary entry. This is not seen by anybody. No one can see this. You can't see this in the clinical view of BadgerNet. This is just her personal diary. However, we do have, as part of Better Births, the support conversations, your personalised support conversations. So, for example, if I click onto antenatal, hopefully it will appear. Yep. I can start as a mother. I can start a personalised care plan for myself. So it will tell me what my management plan is, but also I can put my thoughts and comments around my plan. I can talk about what matters to me. So this might look familiar in terms of the Better Births personalised care plan. I can talk about my emotional well-being. All that kind of stuff can be put in here. And then what will happen is, once that's done, the midwife at the next appointment will be flagged to review it, and then they can review it with the woman on the next appointment. So that can be done for antenatal as many times as you like. Birth, which would be your birth plan. So in here would be the birth plan. This is very much like what you'd have for a birth plan. And again, once that's completed, it will also be visible in the clinical view. The midwife can view it and discuss it with the woman at the next appointment as well, as part of that. And before I come to you, Bab, I will say also postnatal. So you've got one for postnatal as well, all part of the Better Births. Babs.
Can I just ask, what do you do for ladies who can't read or write, or don't have access to like smartphones or anything, any way to get an app?
So a couple of things. So with that, you always have to have a backup for those kind of situations. So you might, I think Gail will have to have a look on feedback as that. Gail will have to look at, normally you'd have a paper copy of the booking and all that kind of stuff, rather than having the app. But if they don't have access to smartphones, stuff like that, I know, I'm not sure if you're part of it, but they do have the Goodwill Foundation.
Good Things Foundation.
Good Things Foundation.
It's something that we're looking to launch before we launch BadgerNet. And the Good Things Foundation can offer SIM cards for those that already have a smartphone but maybe don't have access to data or the internet. or there is a small amount of funding for actual devices. So what I found in my previous trust is that SIM cards were used quite a lot and the devices weren't needed quite so much, because most people now do have a smartphone. Did have a patient in George Eliot that refused to have their details at all on BadgerNet. Now, we checked with our legal team and everything, and because it's our noting our documentation, and actually this is what provides our patient safety, we were still allowed to document. But obviously the woman then just refused to access BadgerNotes. What you can do is every time you go on to BadgerNet, and every form that you complete, you can go and print that. Now, I know at the moment in community there's some issues around printing, but all of that is on my radar to fix as we go along. Babs.
Sorry, my only other question then. So what about ladies who don't speak English? Does this come up in different languages
yes,
also?
Yes, it does. There's about 10 at the moment. We're limited to 10 at the moment. There's 10 languages, and I can't remember which one it is now, but we are, this year, we're going to do another 10. It takes a lot of time. So we've got 10 at the moment. I can send you the list, Gail, or something you can pass on.
Brilliant. And then that converts it so we can read it.
Yeah, so they can read it. Yeah, that's fine. So that's that part of it. So each bubble, as said, will have their week, and you can figure this, and I'll show you about configuration in a minute. If we go back to the top, hopefully these things will work. Maternity record. Let's see if this top bit works. Yep. Okay, so the maternity record part. I'm not going to talk about this anyway because we don't have BadgerNotes anymore, so that's fine. But yes, we do. It will set up in the background once you've done the booking. Obviously, you'll say who the name midwife is, who the team is, who the consultant is. So they'll be able to see the names of the people that are in their care. They won't see pictures because the pictures is gone now. We're not doing pictures anymore, but they will see the names. So they'll see the names of those, the name midwife, the team members. If they've got a name consultant, that will also be there as part of that. Also, you can also from BadgerNotes the woman can give access to the GP her notes. So at the moment, GPs won't have access, obviously, don't have access to her app. However, the midwife can choose to do that, and the mother can choose to do that as well. So what that would involve is that the GP would have to just click on it. Is it going to do anything? It's very slow. I don't know what's going on today. They would have to have an email address. The mother would set them up, the woman would set them up with access, and they have access for 24 hours. It's very limited. They only see the maternity notes tab, which I'll show you in a minute. They don't see anything else, so it's limited what they see, but they do see all of the kind of care that's been done as well. So they will use this part to do that. Go back. And then this is basically sort of summaries of things. So the first one is a welcome summary. So it's a welcome to her notes. You can configure this to make it very specific for your trust as well. So it'll just tell you, it will also give you like your help and advice from here as well as part of that. And you can configure that yourself. The next bit is the key details. So from the booking, from care, it will give you the key details. For example, for a GP looking at this, they can see when the LMP date is, when the due date is, what the risk factors are, just to get a little bit of a quick kind of look at what's going on. It will display the latest management plan, who's under the care, all that kind of stuff will also sit there as well. Scans also can be seen here depending on how you're doing your scans. So you don't get scan pictures, you don't get the scan documents, but you can, if you are using the scan note in BadgerNet, then some of that information will be seen here, which we'll discuss in further weeks as we go along down the pregnancy pathway. And then the antenatal care summary then, and you'll have the same for postnatal care summary if she's postnatal. Let's give it a second to load. Then this will show every visit and what happened in each visit. So in here, you can see all the visits I've had. So I've had an antenatal assessment here. If I click onto it, it would give me the details of that assessment. If I went onto the obstetric clinic consultant review, then it'll give me my consultant review bits. So it gives you the details of each review if it's been published as well. So you get all that there coming from the clinical view. And then lastly on this section is your bloods and microbiology tests. So if bloods and microbiology tests have been inputted in the clinical review and published, it doesn't go automatically. You have to say that you want to publish. They would also be here. So it will sit in here and it will give you the results and any additional details from that result as well. But that only comes there once you've published, which again, we'll look at as we go through week by week. There is a glossary. I'm not going to come to leaflets. I think that's what messed us up last time. So there's something wrong with it at the moment in test. There is a glossary. So it just basically just describes, if it doesn't load, describes some of the acronyms that might be used and what they mean for the woman. And then that's taken too long. So I'll move on to hospital contacts. Hospital contacts will just basically, again, a configurable area where you can have all of your hospital numbers and things. So, you know, your delivery suite, your community office, you know, your assessment unit, all those kind of stuff you can configure in the back end and put that in. Okay. Also, the last couple of bits in terms of that is that there is a bell. So you do get push notifications to the app. You don't get texts, you get push notifications. So you can get a push notification for an upcoming appointment. You can get push notifications from your trust. So if you send out a push notification for all BadgerNet users, then they will sit in here as well. So reminders as well as push notifications sent from your trust will be here. They can view them in the bell. And then lastly, then you have the profile section. So I'll explain each one. So the woman has access to her pregnancy notes forever. So I've got 2 kids born in BadgerNet. The last one's 7, and I have access to that. So they don't close. We don't. When the pregnancy closes, we don't close off Badger notes. They will have access forever. Every pregnancy they have, they'll have one of these. They'll have a tile that says pregnancy in each one. The new thing we've done so far, so if you did have an unfortunate outcome in that pregnancy, you can actually, it won't show me on this one, but you can actually hide that pregnancy, because if you don't want to see it every time, you can. So there's an option for the woman to hide a particular pregnancy, especially if there's, you know, been an unfortunate outcome. You can also, if you are having care location at different care at different care locations, you can select those from there as well. You can also manage your care location. So this is where you'll manage your pregnancy. So if you've got one that was a miscarriage, maybe you can click onto it to hide it as well. So that's what the eye icon is for. You can manage the GP access that we talked about as well. You can edit the account slightly. So you can change your password. You can change, I have to log back in, but you can change any of this bits. A woman can change her email address or telephone number from here as well, which will update the profile. And then lastly, we have feedback. So feedback then is your family and friends test. So your family and friends test can be used in BadgerNet. You don't have to, but it is there, and it is. I think we've got this release. We've updated it with a new family and friends test, but it is a direct copy of that. So the family and friends test can be completed in BadgerNet, and obviously you have the 3 stages, or is it 4? 3 or 4 stages that they appear throughout the pregnancy as well. The last couple of things, we do have a help situation. So if they have any issues with their app, then there is a help situation, a help screen here that they can use to look. We've really built up on this from a lot of the questions that we get asked as well. One thing I would say about BadgerNet is that you have to think about who would manage queries from women, because it can be quite a lot sometimes. So yes, it could be a digital midwife, but you might need to think about maybe someone designated to take phone calls from women about their app, because you will notice, and I'm sure Gail will speak about that, you do get quite a lot of questions about their app. So thinking about how does the woman contact you about their app as well. So some trusts have a designated email address or a designated phone that they can contact if they have any issues with their app as well. And that is everything to do with BadgerNet front end. I will go through the back end with Gail after, but is there any questions around what you've seen so far?
Babs has her hand up.
Oh, I thought it was a historic hand, Babs. Oh no, it is
a
historic
old hand. Okay.
It's an old hand.
Now we have recorded this, so if anybody goes away, looks at this again and decides that they do have questions, then in the first instance, you come to me. I've used BadgerNet before, so I might be able to answer your questions, and if not, I do have a direct line to Shireen to ask her a question. I think the more of these that we do, the more familiar you get with BadgerNet. I think the more you will have questions, but we are going to try and encourage some more attendance to these meetings, because this is a tool. We will configure the tool to meet your needs, but we need to be aware that we are not just going, well, we're moving from paper and putting that paper onto a computer to complete. We're trying to work smarter, so it makes it easier for all our staff. So things like when the woman does get access to that pre-booking questionnaire, it fills in all the information that is really standard that the midwife can review with the patient, but that will cut down the amount of questions and time that's asked in the booking appointment. Things like with Grow 2.0 being integrated into BadgerNet, that will reduce the time again that midwives have to go on to a separate system to set up and duplicate all the information that they've taken from booking onto Grow. It's all integrated. So we're hoping that this will improve morale and also be some time savings. But we do need to make sure that we look at the processes, and that's why I've seen Ola and Charlie on the call. And they'll be coming around to the areas to look at the processes, what our policy says, what we require from a reporting perspective, and how we can make it easier for staff. But that's going to be a big conversation, and we need that interaction. So any more questions for Shireen, or shall we bring the meeting to a close for this element?
Can I just ask, sorry, does this invite go out to all midwives?
It's not all midwives. It's the invite was sent to a list of midwives that I thought would be relevant. So most of the hospital staff probably wouldn't need to know about this bit, because if somebody's turning up in labour and haven't been booked, that's a different process. We're not going to get the woman to add herself onto a self-referral. That so looking at the invite list, there was all the team leaders from Bedford and Luton and relevant matrons. So
yeah, I was just booking on my team to allocate them a time to come on this for the training. But if they don't get the invite, are they able to do it, say, on my invites on my laptop? Am I able to sit them down and allocate them?
Yeah, Cassie, this isn't training.
No.
This is an overview to get the people that can make decisions to help us make those decisions and understand what decisions need to be made. So this is an overview, and we'll be coming out and having a separate conversation without Shireen there, just to say, right, okay, what exactly do we want to collect from that self-referral form if we go to the very beginning? And that's not for me to decide. That's for the matrons and the team leaders in community to tell me what to do.
Okay.
All right.
Yeah.
But if you have somebody that can come in your place, you can always nominate somebody and just forward the invite onto them. But just let them know this is not training. It will be to understand what's available and what decisions need to be made.
Yeah, that's fine.
Giselle.
Yeah, so I was just coming in on Cassie's question, really. Yeah, we're right at the start of the journey here, Cassie, and sort of as we're coming out to roll out, there'll be a whole bundle of education that's rolled out around this, won't they, Gail?
Absolutely.
To that. So don't worry too much about that, Cassie. That will all be very robust around the time. This is just the initial part of just sort of letting us know as leaders, have a little taster, really.
Yeah.
Okay, thanks, Giselle.